It's still Frontline on NFTV, and we're going to be talking on something that has been, it went down in 2019, and all of a sudden in 2020, it came up again, and it's a serious health issue. It is something that is not meant to be overlooked, but to be taken seriously. And this is on the re-emergence of Lassa fever in Nigeria. Now, Lassa fever was first originally discovered in 1969 in Borno State, when two missionary nurses died in a village called Lassa in Borno State. The village was named after the fever once it was discovered in 1969. And in 2018, an outbreak of Lassa fever occurred in Nigeria, and it spread to 18 of the country's states. And as of February 25, 2018, there were about 1,081 suspected cases and about 90 reported deaths. And 72 deaths were confirmed to be as a result of Lassa fever. 21st January 2019, the Nigerian Center for Disease Control, NCDC, declared an outbreak of Lassa fever following an increase in the number of cases. And as at 1st January to 27th January 2019, a total of 213 confirmed cases, including 41 deaths, were reported from 16 states, including Edo State, Ondo State, Ebonyi, Kwara, Benue, Rivers, Nasarawa, Kogi State, Anambra, Taraba, and so on, and across 40 local government areas. This was a major increase in the reported cases of Lassa fever. January 2020, this year, a total of 82 cases of Lassa fever, including 14 deaths, were confirmed by the Nigerian Center for Disease Control, NCDC, and 8 states were recorded, among which were Edo State, Ondo State, and Ebonyi State. Now we can see for the past 2 to 3 years, this has been a recurrence of Lassa fever, continuous case of Lassa fever. And today we're going to be discussing on exactly what Lassa fever is, how to prevent it, how to treat it, and basically just how to keep ourselves safe against this occurrence. To me, discussing this with me is Dr. Adeleye Babarinsa. We've been talking on Lassa fever, the disease, it's recurrent. But what exactly is Lassa fever?
Well, from the name Lassa fever, it's a disease that comes with fever, which most of us are familiar with. Fever is when there is a rise in the body temperature beyond normal. And Lassa actually is a town in Borno State, just as you rightly said, where that fever was first discovered. And to make it more detailed, it could be called Lassa hemorrhagic fever, because that's one thing that distinguishes it from several other causes of fever like malaria, typhoid, and all that. At the advanced stages, the person can begin to bleed from the nostrils and several other parts of the body. So it's a fever caused, so in summary, it's a fever caused by the Lassa virus, and that causes, in its advanced stages, bleeding, hemorrhage, and it's usually very deadly.
Well, it is deadly. One thing that we've discovered is Lassa fever is quite transmittable, considering the fact that it causes a number of deaths and most people end up getting it. How exactly is it transmitted?
Yeah, it's transmitted when human beings come in contact with the vector or the animal that carries it, which is the Mastomyl natalensis rats. Okay, it's also called multi-mammate rats. So once human beings get in contact with these rats, whether through its feces or its urine or its excreta, whatever, the chances that that person gets it is very high. And at times it may not be a direct contact. It might be that the human or we get in contact with either food, food items that have been exposed or contaminated by these rats, and when people ingest it, I mean, they get the fever. Or if people get in contact with people that have been infected already, they can also get Lassa fever. So those are the major ways in which this fever or this disease is being transmitted from one person to another person. So what are the major signs and symptoms to identify that this might be the beginning of Lassa fever, especially considering the fact that, once I heard of fever, most times we mismanage so many things, and we might end up treating, Nigerians end up treating malaria for typhoid and all of that. So what are the signs for us to actually say that this is beginning to look like Lassa fever? Well, this is the reason why a lot of people die from Lassa fever, and you must also know that the cases that were talked about are the cases that are reported to the hospital. There are many people that probably were sick and died, especially in rural communities where, I mean, that died from the Lassa fever that nobody knows about. Okay, because most of the time these symptoms, initial stuff of Lassa fever looks like malaria, typhoid, or anything that you may not think of. Things like fever, general body weakness, headaches, at times it could cause cough, chest pain, sore throat, abdominal pain, vomiting. These are things that you would naturally not think it should be something serious. By the time it leads to things like bleeding from the nostrils, that is the advanced stage, of which most of the time patients who are brought in at that stage eventually dies, except those that are quite lucky. So what I would say is that we must not wait for the symptoms. Prevention is just better than cure. Then if people feel they have normal fever, it could be Lassa. So it's always advisable, especially at this time when there's an outbreak, that when people are sick, when they have fever, they go to the hospital, they run the required tests, so that if it is confirmed that this is not a case of malaria or this is not a case of a bacterial infection, it's very easy to quickly suspect Lassa fever, and they can make a confirmatory test, so that, because once these people are picked early, the chances of survival are very high compared to when they present to the hospital late.
So how long does it take to come down with the actual fever?
Well, it's the incubation period, which is the time from the infection to the fever, or to the manifestation of the disease, varies. Actually, it's a range of between 2 and 21 days. So some people contact the virus now, and in 2 days they're feeling feverish.
Wow.
And some people might take up to 3 weeks, and that's why someone may be normal or appear normal but may be carrying the virus and may infect someone else, and the person may not be aware about it.
So the basic thing is, once you're feeling fever, you're not feeling well, no self-medication, of course. Go to the hospital. Okay. When you
that's advised, but we know in this part of the world most people don't do that, especially because many may not be able to. Some people can't afford the hospital prices. Most people are not on insurance and all that. But the truth is that ideally that is the best, to go to a proper healthcare center to be properly tested and treated. You're
treated. Okay. When you were talking, you were saying it is transmitted by a rat.
Yes.
The name is, I can't quite pronounce it.
Well, Mastomys natalensis, or simply multi-marmot rat.
Multi-marmot. All right.
Yeah.
Rats, are they the only ones that can actually spread this Lassa fever? They are. It's just limited to them.
Yes. Rats and human beings. So no other animals are expected to actually transmit this virus.
Okay. So which predominant age groups, is this Lassa fever can occur? Is it between a certain age, or anybody can fall victim?
Interestingly, anybody can fall victim. Although from the research done by the Center for Disease Control, CDC, I think so far it's between the ages of 11 and 40 that it's predominant. But the truth is that actually anybody can fall victim of this disease, and the impact is worse on children, especially on babies, and if they come in contact with it, their chance of survival is much lower.
Okay, all right. Are there chances of death after this infection?
The chances are high. Based on statistics, usually it's between around 1 in 5 people. So if 5 people get infected, there are chances that at least one of them is going to die of it. So, and that's quite high. Because usually during epidemics or outbreaks like this, it's usually higher. It could rise as high as 1 in 2 people, that would die once they get the infection. And usually for pregnant women, it's even the highest, because once the pregnant woman has contact Lassa fever or the Lassa virus, the chances are 4 in 5 of them may likely die. So that's 80% fatality rate. So the chances of death are quite high. It's quite high once people contact the virus, and that's why we must do everything to avoid getting in contact with this virus, preventing the transmission, because every life matters. I mean, that's someone's child, someone's brother, someone's sister, and to save a life is very, very significant.
It is. Yeah. Now, one thing I've discovered is, as of the cases that were recorded, most of them happened between January to February. And of course, we know that this is the Harmattan period, when Harmattan occurs the most. Can we say this has anything to do with Harmattan, this Lassa fever?
Well, it precisely has more to do with the dry season. Why? Because you see, this rats that transmit this virus actually, of course, lives in the bush and all that, I mean, they multiply rapidly, and they find it convenient to live in the bush where they can get their food products and all that from the food from the bush, you know, but the problem is during the dry season, I mean, everywhere is dry, the leaves, there's a lot of bush clearing, bush burning, so they have to leave their natural habitat and look for people's homes, I mean, to stay, you know. So you have more rats actually in people's homes during this dry season, and that increases the chance of having LASSA. So usually between the period of November and May, where it's the dry season, the outbreaks are usually high, but especially when it comes to January, February, March, I mean, that's usually when you have the worst case of, because that's when the dry season is intense. I mean, by March, rain begins to start a little bit, you know, and all that. So it has to do more with the dry season.
All right, this multi-rat,
yes.
Is it the usual rats that we see, those ones that just come in the house, or this small ones? Are they the ones that carry this LASSA fever, or they are another special breed still from bushes?
Interestingly, many of these rodents look alike, so it could be very dangerous if we decide to confirm, okay, are the rats in my house the multi-mammoth rats? It's very dangerous too. So it's just good to play safe. But once a life is lost, the life is lost.
Of course.
There's no opportunity to go back and trace and begin to take the required precautions. So it's just good to take precautions. The multi-mammoth rat is actually one of the most common rats actually in West Africa. Okay, even though, I mean, they have some things that appear to differentiate them in terms of the fact that they have multiple mammary glands, just as I said, even though most rats do that, you know, but the truth is that they are abundant. They are one of the most common rats in West Africa. So it just means that it's good we assume that all rats are multi-mammoth rats, you know, or to prove otherwise. And interestingly, some people even eat these rats.
Wow.
You know, and that's even especially in the rural areas, and that even increases the chance of infection more.
Okay, in increasing the chance of infection, you were talking about this kind of rats peculiar to West Africa.
Yes.
And of course, we've known that this LASSA fever has just been within the geographical location of Africa,
yes.
affecting places like Liberia,
yes,
Sierra Leone, and Nigeria
yes.
as the most impacted nation. So are we saying it is because these rats are here, only be found in West Africa? That is why LASSA fever is majorly here? Yes,
that's the main reason. That's the main reason, because you find these rats, the habitat of these rats is more within our region, so you will likely not. Yeah, you can find it in other places, but the incidence of LASSA reported in other parts of the world is extremely low. It's not really significant. It's more in West Africa, and Nigeria interestingly has the highest incidence of LASSA fever, even in West Africa.
Okay.
Yeah.
Well, in treating this, are there vaccines on the ground to help?
That's the major challenge, because if there was a vaccine, then the hopes that we can eradicate LASSA fever will be high. But for now, there's no vaccine currently. Over about 15 years ago, thereabout, there was a military hospital in the US that produced a vaccine which people thought would be relevant, but eventually was found not to be very effective. Okay, so currently there's no vaccine. So the only thing we can do is to prevent it, because the other option we would have had is probably to kill all the multi-mammoth rats in the world, which obviously would not be possible. So the only thing we can do is just to see how we can prevent contact between rodents and human beings, and it's actually very possible, especially in the developed parts of the country. You know, the major challenge more is in the rural areas, but yes. The truth is that even in the developed, because the truth is, if you keep your environment clean, I mean, you don't have refuse dumps sites close to your homes where rats can go and play with and try to look for something, you know. If the environment is clean, you have less rats, and when there are less or no rats, I mean, transmission of LASSA fever is much reduced, you know. So but the challenge is that and that's why we have to be interested in also the development of rural areas. Yes. Because even if the rats are not here and they get infected, they bring them to the urban areas for treatment. I mean, it could get transmitted from one person to another. Of
course.
So,
all right, let's divert a little. Yes. Permit me. Now, in science, when we were in school, we know that there are certain immunities in our bodies, yes. Some certain blood cells. You can correct me if I'm wrong.
Exactly, you're
that
right.
fight against diseases
yes.
and sickness.
Yeah.
As an human being, don't we have any sort of immune system to fight against things like LASSA fever?
We do. Interestingly, from research, not everybody that gets infected with a virus actually comes up with the disease.
Okay.
So there are people that they're just lucky. I mean they're exposed to the virus, and they end up they don't end up dying from the disease. The same thing to not everybody, just as I already said, not everybody that comes up with the disease ends up dying from the disease. In fact, I said about 1 in 5 people would die from the disease. So that means that in such people, the immune system was very, very effective in fighting against this. Even though in certain cases too, the drugs that we give, ribavirin, that's a drug, antiviral drug we give, can also help to suppress the virus. But essentially, the immune system, goes a long way in helping to fight the disease and preventing everybody that is infected. Not all of them eventually comes up with the disease or die from the disease. So it still works.
All right.
Yeah.
All right. Well, we'll just have to trust our immune system in some cases. Of course. Well, is there a way this virus can be effectively controlled? Now, let's go back to 2016 when the case of Ebola happened.
Yeah.
And of course, at that moment, I can say I was really proud of Nigeria because we were able to control it. That was just limited to a certain number of people, and it wasn't as widespread as the fear was that it will be. Now, this is LASSA. We've had an occurrence of it in 2018. We've had an occurrence in 2019. This is 2020, and we're having another occurrence. Is there a way that this fever can be eradicated, or better still, effectively controlled?
Well, the good thing about Ebola, if there was anything good about it, was that when Ebola came to Nigeria, it came more through the high socioeconomic class. And what I meant was that, we had reports, someone came from abroad, came to Nigeria, and we had even top people die. So there was a lot, and the whole world actually was much involved in the fight. And the vector is not as common. It's not like what you have in Lassa fever. So it was much easy to control. Because if Ebola had started more in many of these rural areas, where in a lot of those places there are no primary healthcare centers and all that, that it may have been easy to spread. Then it was obvious that during the Ebola time, the government also put a lot of things in place because Ebola was going to be very, very dangerous. But the challenge with Lassa is that, number one, Lassa is caused by a rat that multiplies rapidly.
Okay.
And it's more of confined within West Africa. So that means that the bulk of the burden of solving the problem lies with West Africa mainly, even though the world is trying to solve the problem. So it's more difficult. And also, Lassa is something that's been recurrent for many years now. Almost every year we deal with this problem. So it's really, really difficult to contain it. The only hope we have right now is if we can get a vaccine, that can actually help prevent this disease. But for now, the chances of, we can only hope that we can only reduce the burden and hope that the vaccine will come out soon. But in terms of eradication, we can only still keep on trying. But the possibilities are much less without the vaccine. So
without the vaccine, there is no way that...
Well, nothing is impossible, but the chances are much less. Because the rats are everywhere. The rats are everywhere. Or like Ebola, where it's more of the monkey, that particular kind of monkey and all that. But these rats, the rate at which rat grows and multiplies, it's overwhelming. They multiply so fast that they're usually used for experiments and all that. So that's why controlling Lassa is going to be a lot. Without the vaccine, eradicating it will be a lot of work.
All right, we've been talking about vaccines and vaccines. Now, you've said that they've not been able to find a way to develop this vaccine.
Yeah.
What is delaying it, if I may ask? Is it, I don't know, what exactly is delaying finding the vaccine to cure this?
Well, one thing we can be sure of is that, number one, Nigeria is the worst hit from Lassa fever.
Okay.
So if there's any country that should actually be at the forefront of discovering this vaccine, it is Nigeria.
Okay.
Even though we're aware that the WHO has recognized Lassa as a threat to global public health and is trying to encourage nations of the world to discover vaccines for this deadly virus. But Nigeria is supposed to be at the forefront. And you will agree with me that Nigeria currently has a lot of challenges with our healthcare system. It's not just Lassa that is killing people. It's amazing that something as little as malaria is killing children every minute. A child dies of malaria, and you can estimate the number of children that will die in a year by the time you calculate that. You understand? Thousands of children. So, and there are a lot of other, and we live in a country where our primary health care system is probably not too functional. I mean, the average Nigerian cannot boast of a particular health center that he or she is attached to for health care. The average Nigerian would rather just go to a chemist, treat themselves. You know, in health insurance, there is supposed to be, which is what has been adopted in most countries of the world, to ensure that every citizen can work, because nobody saves, nobody plans to use money for sickness. Nobody plans that I will have malaria tomorrow, I'll go and spend 2,000 naira, 3,000. So the concept of health insurance is to ensure that you're covered. So you just walk into the hospital and you get treated. But unfortunately, I mean, we still have less than 10%. I mean, different values. People are saying 5% of Nigerians are under health insurance. So aside from that, we're also aware that there's a massive brain drain in the country right now. You know, everybody keeps telling me, why are you still in the country? You know, and really, it's very, very easy for a doctor to leave the country. But I keep telling myself, if we all leave this country, what's the hope? Are we making things better or making things worse? So what I'm trying to say is that we have a lot of problems on our hands than to sit down in discovering and focusing on vaccines. When even the most developed countries of the world have tried to develop a vaccine, they've not succeeded. You know, so it means that you can put billions of naira, because it's going to cost a lot of money.
Okay.
So you can invest billions of naira into it, and eventually it doesn't work. So, but what I believe is, I believe that the experts are still working on it.
Okay.
And we can just hope that very soon a vaccine will be out. But I know it's not going to be an easy journey. Yeah.
Well, in hopes of waiting for the vaccines to be out to just bring an end, in quotes, to this Lassa fever, what are some of the preventive measures to actually stop being infected from this?
Yes, prevention can be at several levels, and for the sake of my audience, it's important you understand what you can do at your own level as an individual, because you can't rely on others. So you can talk about prevention at the personal level, prevention at the level of the hospital, that's for health workers, and where the government actually can play a part. So for the government, well, we hope they'll play their part. For the health workers, like we that at higher risks, there are some things we need to do. But I'm more interested in you listening to me. Okay, so the first thing you need to do is to ensure that you stay free from rodents as much as possible. Okay, so that means that you should keep if you live in areas where you have a lot of grasses, you want to clear your grasses so that rodents don't find your neighborhood as an habitat. Okay, and if you also make sure that you ensure that your house is not porous for rodents to enter, so you block all loopholes in your house so that you keep yourself as far from rodents as much as possible. Then also avoid having refuse dumps close to your house, because when you go and dump your refuse a few meters from your house, you expect that rodents will come and look for something to eat there, and that's you encourage the spread. So once that is done, another thing you also have to avoid is to avoid your food substances from being contaminated by rodents. So just in case one or two of them eventually comes into your house, then you want to make sure that they don't get into your food. So you ensure that the food are stored in rodent sealed containers they can't enter easily. Because in some houses, some people will testify, they will see rodent feces inside their rice and they will still eat it. Okay, so once you have done that, the next thing is that to ensure that you avoid food contaminated by rodents. Okay, so once you see that this is contaminated, some people, maybe there is a bread somewhere, the rat eats out of the bread, they will cut that part away. You know, it's amazing what poverty has done to our people, you know. So you want to avoid food contaminated by rodents, and if possible to almost all your food, make sure you wash them before you cook them thoroughly. You want to also wash your hands and all that. Then it also thank God for a lot of products are being sealed now. It's better because you see when you go to the market, a lot of food products, especially when the worst one is our normal gari, you know, it's always exposed. People can put their hands easily. It's very easy for things to be transmitted that way. But most importantly, on a personal level, you need to ensure that once you have fever, as much as possible, visit a nearby healthcare center or hospital, especially if you can afford it. But the truth is, it's best for all of us, so that you can do proper tests, especially this time when there's an outbreak. So once it's confirmed that it's malaria, you can treat it. And if it's not malaria, you want to be sure it's not LASSA or something else. Because the problem is, people start treating malaria for days. When it's not, doesn't go, they now come to the hospital. By the time they are coming, it's almost late. Some of them would have even died before they come. So it's important we put all these preventive measures in place. And I tell you, the chances that anyone will contact LASSA will be very, very, very low. I mean, we just have one life to live.
Of course, of course.
Yeah.
Is there no way that we can perform simple malaria tests at home, or we just have to go to the hospital?
Well, ideally, it's possible. Okay. It's possible. I don't know whether it's being encouraged, but actually there's what we call point of care test malaria kits, okay. You know, where that the test can easily be performed. Because one thing I like about the whites, you know, it's that they try to make everything easy. Like I know currently they are promoting this self HIV test kits, okay. Where a person can use even saliva to actually confirm whether the person is HIV positive at home. Okay. Even though there are still some ethics that are going into that. So, but currently, I'm not sure. Those kits we have currently, not everybody will be able to use them. So they are not designed for home testing. But let's hope, because I think because malaria is so common. Yeah. So I think that we should be looking towards helping people to test malaria at home, so that you know. But there will still be a lot of ethical issues involved. But why? Because are we also saying that people should be treating themselves once it's positive? So it's not something that would go. But let's hope it's something that one day we'll discuss about, and we'll make it easy for people to get care.
All right. Well, let's just come to the resolution that anytime there's a fever being felt, go to the hospital for proper testing. Yes. Now, when you were talking, you were discussing on the necessary things for healthcare workers to do in order to prevent this Lassa fever. Now, of course, like you said, healthcare workers and most of the time the secondary people to take the heat of this Lassa fever. What can be done to help these people? Because a lot of them end up dying. We've heard of cases of doctors that end up dying because of this Lassa fever as a result of them treating an infected patient. So what can healthcare workers do to just keep themselves safe from Lassa fever?
Well, I guess this might also not be unconnected to the fact why some people would prefer not to stay in the country, because the truth actually is that a lot of health workers are being exposed to risks as a result of the fact that most of the centers are not well equipped with basic equipment that will protect them. And once anybody dies, the person has died. Okay, so one of the things that we must encourage the government to do is to ensure that every healthcare center is actually well provided with all the personal protective equipment that they need to protect themselves from any infection. Okay, so it means that they should have enough gloves, they should have enough water, they should have enough hand sanitizers, they should have enough kits, I mean, to protect, especially when there is a suspected case of Lassa and all that. They should have all these things. They should have running water. It's amazing that as little as some of these things are, you will not find some of these things. You understand. And even as little as electricity is also important, because if you attend to a patient at night, you need a proper illumination to be able to protect yourself from the patient. So these are little things that the government has to put in place. But on the part of healthcare workers, people also need to take care of themselves. So as much as possible, you want to ensure that you wash hands as often as possible, because you don't know who you're getting in contact with. You want to ensure that you wear gloves, you know, especially when you're dealing with people's blood and body fluids and all that. Those in the laboratory also need to be very careful, because they're getting blood samples, and which put them at more risk. Okay, then health workers also need to also care for themselves. I mean, make sure that if they are sick too, they also do not treat themselves without appropriate tests. So health workers just need to also be on top of their game, especially at this time, because it's not a nice thing when we yet. Thank God this year so far there's been no reports of any health worker that has died, even though we heard about an incident in Kano, which is not confirmed yet, about a pregnant woman that some doctors were attending to, and I think 2 of the doctors died or something. But the cases has not been confirmed whether it was Lassa or something. But health workers need to just be careful so that we don't allow this disease to affect us. All
right. In the case of the pregnant women, now let me ask. Of course, Lassa is known to have a very high mortality rate, where a lot of pregnant women die as a result of this. What can be done to reduce this mortality rate among pregnant women?
It's interesting that a lot of pregnant women in this part of the world would not go for antenatal care, especially if they are giving birth to 1 or 2 children. They would rather go for traditional birth attendants to get them delivered of their babies, and that at times is a problem, because many times the only time they eventually come to the hospital is when they are dealing with a problem that it's severe. So if most pregnant women can come to the hospital on time, register in a proper hospital for antenatal care, it will reduce a lot of maternal mortalities that we have.
All right. With the maternal mortalities and every other person being affected by Lassa fever, should we be looking at an epidemic, a full-blown epidemic in the future in Nigeria when it comes to Lassa fever?
Well, the WHO has said that Lassa fever is one disease that might cause an epidemic in the future. And that's the reason why we really need to be very, very cautious. I believe that every Nigerian should be well educated about Lassa fever, even as low as primary school, at the primary school level, because Lassa fever has been with us for a long time and has refused to leave us. So we need to ensure that everyone is educated. If we can all be educated, then we know why we're doing what we're doing when we are preventing Lassa fever. And it's amazing that we should not do these things because of an outbreak. You know, it's amazing during the time of Ebola, a lot of things were done that people thought those things were things that we're doing because of Ebola, but those things were supposed to be normal things. For example, during the period of Ebola, people were conscious of washing their hands.
Yes.
You see a lot of banks and industries ensure they have taps outside for people to wash their hands.
Sanitizers.
They were hand sanitizers.
Yes.
Those are not things that should be done. Those hand sanitizers are not protecting you just against Ebola. They are protecting you against any microbes generally.
Yeah.
Okay. Then you see during those times, you see a lot of hospitals too being careful, you know, as regards the way they care for patients and all that. But then when you go to hospitals, you see them, you know, it was one of the most interesting times. You see people taking queue just because of they want to check their temperature. I really don't know if you ever attended any hospital around that time. So then there was this infrared thermometer, which is supposed to be normal. So the thermometer doesn't have to be in contact with you before, because the usual thermometer you have to put it on your armpit, then they will clean it and use for another patient. Of course, that may increase chances. But so those infrared, so some people thought those infrared thermometers were Ebola detectors. They're just thermometers, just to ensure that this person, you know, these are things that we need to begin to put in place. If when you go to some more advanced settings, you can't touch the tap. You don't need you don't need to touch the tap. You just put your hands under the tap, and your hands are clean. Your hands. You wash your hands. You understand? Then you also dry your hands, and so that way you minimize contact. So these are things that we need to put in place, not because we're trying to prevent a particular disease, but because it will help us to prevent diseases generally. You know, and if people are educated, people now understand that these things are just there for the sake of the general health, not just because of one particular disease.
All right. What else do you think the government can do to just help curb this Lassa fever? I mean, so far it has been found in Edo State and so many other places. And who knows any other states that might be it. So what necessary things does the government need to put in place in order to just curb this outbreak?
Well, aside from trying to invest more in primary health care, what I mean is primary care is a system that ensures that every individuals and family in a community get access to basic health care at a price that they can afford. Okay. Aside from that, the government needs to also try to improve living conditions, because when people are struggling to eat, or struggling to survive, they are less conscious about trying to take care of their health and all that. So I think the government needs to work more on ensuring that people have better living conditions. The government also has to ensure that health workers are also better protected, so that they're well motivated to prevent this disease, and primary health care generally. Then also, which I think it's also important, is the issue of discovering vaccines. So the Nigerian government, in partnership with the Ministry of Health, we need to intensify more efforts in trying to find and discover the vaccine for Lassa fever.
All right. Well, thank you, Dr. Babarinsa. Thank you so much for your time. So far, it's been Frontline, and we've been talking on sure it is prevented amongst people generally, and we're talking about the preventive measures, how to curb it, and hopes of it being eradicated, especially via vaccines. And we just want to encourage everybody to make sure they keep their environments clean and neat. According to Dr. Babarinsa, make sure everywhere is cleared, there are no refuse dumps, loopholes for rats. No rat is safe. If you see any rats, just make sure you keep the loopholes and try your possible best to find ways of killing them.
Yeah.
Obviously, it is okay to kill them.
And
just
don't touch them
don't touch them. Okay, so don't touch them after killing. Just find a way to push them off, and just at the end of the day, make sure you are health conscious.
Yeah.
Health conscious and healthy. An healthy nation is a productive nation. It's been Frontline. Thank you so much for staying with us throughout the show. We hope you had a very fantastic and wonderful time. So we'll come your way again on Monday. Have a very beautiful weekend. Bye bye.